Welcome to the HANDS project. The HANDS project is a health assessment nursing documentation that we use here at Mesa Community College. HANDS was designed to help nursing students learn the process of electronic documentation. It is a learning tool, and that means it will look different than what you actually see in the hospitals. It is designed to help you learn terminology and utilize your assessment skills to make critical thinking decisions. This information is then stored, we can update it, you can add to your patient's file, as well as an instructor can review your charting and offer you any comments. This program was designed using the software FileMaker Pro. It's a web-based data warehouse where we can input data and store it and then retrieve it later as we work. Our simulation labs, as well as the 6-bed lab and the 10-bed lab, have computers at the bedside for students to use. This is what we're expecting you to use for student documentation. However, they're hidden inside these cabinets. These cabinets are locked to avoid any issues, and you will need your instructor to unlock the cabinet and get you started. This is a laptop computer ready for you to use in order to start your documentation. You'll open it just like you would any other laptop. Once you've powered up the laptop, then you'll notice that there are 3 icons available to you. Students will choose the icon called Nursing. It's usually on the right-hand side. You only need to click once. They will not stop you for a login or a password. It takes you straight in to the Windows program. Once the Windows program has completely loaded, you're going to notice that there are many different icons. There may even be a different picture as your background. That's okay. What you're looking for is the icon called FileMaker Pro. That icon will open the software that you need, so double click on the FileMaker Pro icon. Double clicking on the icon FileMaker Pro will open this page. This allows you to choose the Nursing HANDS under Recent Files. So you'll double click on Nursing HANDS. Once you've double clicked on Nursing HANDS, it'll stop and ask you for your account name and password. That account name and password is your MyMCC account. That's the account name we've given, and all students are entered in using that data. Once you have logged in, you will open up to the home page. It'll say Welcome to Maricopa Community College Health Assessment Nursing Documentation System. This home page will allow you to create a new patient, which would be if the first time you cared for a patient and you needed to document on them, or to help you find a record that you've previously started before. Choose the button applicable. This is your patient information page. Place your patient's first and last initial, date of birth, and the last 4 numbers of the MR number, the medical record number. The age and patient ID will be placed automatically. You can also input a brief patient history and visit history, meaning the sequence of events that occurred since hospitalization. From here, create your assessment record by clicking on that button. Once you've opened the record, this page will show a series of tabs at the top of the page. You will record your various body system assessments here. We are showing you an example of the neuro assessment page. The left column will look the same on each page as you navigate through the tabs. It gives you a baseline to look back upon. The instructor feedback portion will remain empty until your instructor has reviewed your record. This is where he or she will record suggestions and comments that you can use in further documentation. Did you see the small happy face, nurse? This is going to become your very best friend. This icon offers a pop-up window of suggestions for terms that you might want to use to complete your documentation. As you become more and more comfortable with documentation and assessment terms, it is more than likely you will need it less and less. Be sure to complete each tab of the assessment before you move on. This is an example of the cardiac page. Did you notice the little green check mark in the top right-hand corner? This provides a critical thinking checklist. Before you complete each page, click on the green check. Be sure you have completed your record. Look at this box. Now that you've clicked on the green check mark in the cardiac section, you notice, oh, I should check the labs for an abnormality of the cardiac assessment. This will help you bring and tie all those different pieces together. This is an example of the fundamentals page. Notice that this is where a lot of your basic fundamental nursing will be charted. Again, you'll need to click on each tab underneath the fundamentals page in order to complete your record. A lot of documentation is recording the observations you have made during your assessment. Under the Fundamentals tab page is a tab labeled What I Did. When you click on that, you see this open space that asks you, what did I do today to prevent complications of hospitalization? This is where you will document the interventions that you initiated or that you carried out that helped prevent complications of hospitalization for your patient. Under the IV tab, this is where you will record your patient's IV sites. Even if you've discontinued that patient's IV site during your time of care, you would still record all that information within this area. Pediatrics, OB, and Psych have their very own tab. You will click on these sections and document in them when you're actually in the specialty areas during your rotations. Once you are ready to enter the patient's medications, you will click on the Med tab. The Med page will allow you to enter each medication the patient's on. Your first step is to click on the Add a Record button. Once you have clicked on the Add a Record button, your first default question is this safe? Meaning, is this medication safe for this patient at this time for the dose that has been ordered? Once you have determined that, using all your resources, then you will choose yes or no and continue on filling in the medical record. Under the Notes tab is where you'll add narrative. Narrative is your documentation that does not fall anywhere else within the assessment. The problem column will allow for DAR, PI, or any other format depending upon your facility's preference. Use your clinical instructor as a guide on which format you will utilize. Under the Care Plan tab is where you will document your number 1 and 2 priority NANDA nursing diagnosis. Remember to include intervention and evaluation. Once you finish documentation, you can go ahead and X out of this record by clicking on the red X in the upper right-hand corner. You can also go under File and Close if you choose to do it that way. All changes that you've made in the record will be saved. Thank you for taking the time to learn and utilize our HANDS program. I'm sure with time it'll become easier and easier and you'll improve your documentation skills.